It's been a little while since we've done a segment about Brazilian butt lift.
Okay.
We talked about it.
Has it?
Has it? I don't know. We haven't done one on it.
I think we talk about butts every month for sure.
At least every month.
Yeah.
But maybe not like a whole segment. But today,
for sure,
I'm going to do a segment based on an article I saw. And the segment is, do Brazilian butt lift results last? And I've talked about this in the past, but I'm not sure we've done a whole segment specific to this. And this actually comes from an article I saw when I was doing some research for topics. Throw up that article, Trey, if you can. Yeah, I'm on my second BBL after the first one died.
Oh, gosh.
Having the perfect body is worth the risk.
Oh, no.
Yeah, so I had a lot of issues with that article.
Yeah.
Just a lot. I mean, it was about a influencer, and she lost a bunch of weight, which is great. Good for her. I think she had gastric bypass surgery. But then she had 13 different cosmetic surgeries in Turkey, of all places, which, as we've talked about a time or two in the past, Turkey is the medical tourism headquarters for Eastern Hemisphere. It's a big problem with people going from the UK and Europe to Turkey. In fact, almost every week I see some warning by some country in Europe telling their citizens, don't go to Turkey for plastic surgery, people are getting killed. So anyway, she went to Turkey 13 times for plastic surgery. She got Brazilian butt lift. And you guys know, I've talked about Brazilian butt lifts a million times. I'll recap it for those who might be watching this segment and not know Brazilian butt lifts. So the reason I don't like Brazilian butt lifts, I'm going to explain exactly what they are in a minute, is Brazilian butt lift does carry a 1,000 times higher mortality rate or risk of death over the average plastic surgery, which to me is just unacceptable. And that's because of the risk of the fat getting into the blood vessels, which is a terrible, terrible problem. But then the other issues I have with it are the not quite as severe issues, such as the fat hardening after you inject it, so it doesn't feel right, it doesn't feel like it should. And then what this segment's about is the fat reabsorption. So is it possible for this girl, that was on that article, is it possible that the fat grafted to her butt died?
I think that it made, just like you said, it went back into her body.
Yeah, she's right. Yeah, it got reabsorbed. Yeah, absolutely.
Or so can it migrate? Could
not really
go somewhere else?
Nah, not really.
I mean, in her
when you inject, so when I'm
something?
injecting fat, and I do fat grafting, I just don't do Brazilian butt lifts. But when you do fat grafting, say you get a little bit more in one area, you can actually mold it a little bit. But outside of that, you're not gonna be able to push it from one side to the other. I mean, you can kind of smooth it out with a little bit of pressure, but it doesn't really move. But yeah, absolutely. That girl's saying that her Brazilian butt lift died. I mean, that's kind of dramatic. It's more like the fat got reabsorbed. It absolutely could happen, and much more likely since she was going to, kind of like a cut rate plastic surgery place.
Yeah.
And I'll break all this down for you. So for those who don't know, Brazilian butt lift is done by harvesting fat from one area and then injecting it in the butt, right? Mm-hmm. We talked about fat grafting. You guys are familiar. When I say fat grafting, you guys are good?
Uh-huh.
Yeah.
Okay,
yes,
cool. Fat
indeed.
grafting. In fact, I have a picture of when I've done a couple of fat graftings for breasts, and I think I brought a picture tray. Yeah, there we go. So that's fat that I harvested, and so I harvested it with the bigger syringes on the right.
Sound like a farmer.
Harvested, yeah, harvest, right? And then the smaller ones are the ones that I'm actually going to inject, and so that was for a breast dog, so I needed quite a bit of fat. But the way you do this is that you harvest the fat and then you inject it into another area. But there's a caveat to it. When fat grafting first came out, and I remember this because it was about the time I was in training, what they were doing first was literally taking the liposuction cannula, pulling the fat out, and then getting the canister and scooping it into a syringe and just injecting it. And when you do it like that, the reabsorption can be up to 90%. Mm-hmm. Meaning if you inject 100 cc's of fat, you're only getting 10 cc's that survives. And so, this girl talking about her Brazilian butt lift went away, well, that probably means that they didn't process the fat correctly because, as I said, in the early days, no one really knew exactly how to do it, but now we do know how to do it. So when I harvest fat, it doesn't just go into a regular canister. It goes into this centrifuge. And so the fat goes into the centrifuge, it fills up, I rinse the fat with a solution 3 times, and while I'm doing it, I agitate it with a little auger, and what it does is it spins it out. And then once you do that 3 times, what comes out of that thing, which I draw out in those big syringes, is pure fat, but very, very fine in nature.
And it's yellow.
And it's yellow. You can see it. That was the processed fat that was in those syringes. And the difference is when you do that, and it's pure fat, and it's in smaller little microglobules, it's much more likely to take than if you just take a big chunk of fat and just throw it in there.
Yeah.
That's not going to work. And so the problem with doing it the correct way is if I put, say, 1,000 cc's of fat into the processor, I get about 300 back. So what happens is if you process it correctly, you're getting a much smaller amount that you're going to use. Now, think about Brazilian butt lift. The average Brazilian butt lift puts 500 to 1,000 cc's of fat into each side. So you're talking 1,000 to 2,000 cc's total fat that you need. But if you process it correctly, that means that you need 2,000 to 6,000 cc's of fat to put it in the processor to get that 1 to 2,000. And therein lies the problem with a lot of Brazilian butt lift. So doctors are having to make this, conscious decision. Am I going to do this properly and not have enough fat? Because a lot of people that want a Brazilian butt lift don't necessarily have a lot of fat.
Yeah.
If they did, they would be less likely to want to do a Brazilian butt lift.
Right.
And so what ends up happening is there's this internal dilemma of, okay, am I going to over liposuction this person to get the fat I need? That can cause problems. Or am I going to harvest as much fat as I can, but then not process it correctly so that I get more volume so it looks good right off the bat, but then knowing that it's probably going to reabsorb. And like all of these dilemmas and problems were my first reason where I was like, this is a dumb operation.
Yeah.
Like it's just, there's so many potential problems with it. And so I was never a big fan. Then of course the mortality issue started to come out as more where people did Brazilian butt lifts. And then I was just absolutely out. So that's kind of the issue is that, when people want Brazilian butt lift, you need to harvest a lot of fat. And so that limits the doctor's ability to treat it properly because you may not have enough fat on you to process it to get what you need to get the result that you want. So, it kind of puts patient and doctor in this awkward position. And, I guarantee what happened to this girl. I mean, she'd had a gastric bypass, so she lost most of her body fat.
Yeah.
So what they did is they harvested the fat, but they didn't process it because they didn't want to lose any of the volume, and they just injected it back in because why not? They're in Turkey. She's going to go back home to the UK.
Yeah, by the time it reabsorbs.
Yeah, like they're not going to be around. Like it's a total scam.
their clinic will be shut down.
Probably. Or so what is she going to do? She can't sue, this facility in Turkey.
Yeah.
So, Brazilian butt lifts are risky surgeries for multiple reasons, but they're even more risky when you go overseas to do them because those people just have no recourse. The patients have no recourse.
No quality control over there.
There's no
whatsoever.
quality control. I mean, you just have no idea what's going on. So yeah, I had a ton of issues with this article, because of all the things that this girl had done, and now she's going back for another one. Well, I mean,
the title of that thing at the end, worth the risk.
Yeah, it's worth the risk. What was the title, Trey? Throw that title back up there. It said
the end of it.
Worth dying for or something crazy. Oh, having the perfect body is worth the risk. Yeah.
Is it? You sure about that?
Yeah, I don't know. I think this girl has some issues going on, to be honest. But to answer the question, is Brazilian butt lifts last? Under perfect scenario, yes. If I was able to process the fat the way I do it, I get really good takes with mine. I think that, on average, I get probably 75 or 80% take, which is really good. The max take you can probably get close to 80%. Like the stated reabsorption is 20 to 90%. So if you reverse that, not what gets reabsorbed, but what stays, like 80 is the max. So, if it was processed correctly, yeah, you could get it to last, but that's the problem. I don't think people are getting it processed correctly. So
yeah.